Hi, I'm Dr. Tom Schell with Nuval Research and the Cur-OST line of products, and also Second Vet Equine Consulting. This week's Q&A session is regarding a very popular topic, one that we get a lot of emails and questions about, and that is laminitis in the horse. Now, I don't want to go into a full detailed discussion about laminitis, take way too much time. We have a lot of information on our websites regarding articles and even some books on it, but I will highlight some of the points. So let's get into this week's discussion of laminitis in the horse. Okay, so here we are, managing equine laminitis. Just a real quick PowerPoint presentation so that we can look at a few things. So the question is, my horse has been diagnosed with laminitis recently. What suggestions do you have to offer? First thing we need to do is actually look at laminitis and understand it. Again, I'm not going to get into tremendous detail here. That's covered elsewhere in articles and other videos and books. But here on the left is normal. Here on the right is abnormal. So on the right we have laminitis, left we have normal. What we are looking for basically here on the left side, normal, is that we've got P1, P2, P3. So these bones should basically be in alignment, which is noted by this line right here. That's your bony column. They should be in alignment. This white line right here is basically outlining the dorsal hoof wall, and that should be parallel to your bony column, or the dorsal aspect of P3 right here. So this red line should be parallel to this white line out here, which is the dorsal hoof wall. This blue line here at the bottom indicates our palmar angle, and that should be roughly between 5 to 7 degrees normal. So what we're looking for here is a normal bony column, P1, P2, P3, in nice alignment with each other, and that should parallel with the outside of the hoof wall, again by this white line here. So if we then move over here to the right, we've got P1, P2, P3. And you can see that this is not a nice smooth alignment here. We come down here and then we jerk down. This red line down here at the bottom is indicating palmar angle. That looks sufficient, at least in this case. And what we're looking for here, we've got, if this blue line and yellow line weren't here, you would actually see two angles to the dorsal hoof wall, noted by the yellow line, and the second angle by the blue line. And where these two intersect is where our separation is starting. Now, what do I mean by separation? Separation is where basically often because of metabolic issues going on, changes in circulatory issues, cellular function, the lamina, which is like a Ziploc bag attachment, if you will, the hoof wall is attached to the dorsal surface and around P3, or the coffin bone. And so due to those influences, which we're going to discuss here shortly, that Ziploc attachment begins to break down. We have laminar separation or wall separation. So then the wall actually begins to break loose off of the coffin bone. The attachments are broken down, put in a very simple way. And then due to loading of the foot, which most of these horses are improperly trimmed to begin with, loading of the foot causes increased toe pressure here, which then forces the wall out, the toe out, and furthers our separation. Hopefully that makes sense. But basically we have two, in most cases, we have got two angulations, two different angulations to the dorsal hoof wall in these laminitic cases. The uppermost angle is actually healthy and attached. You can see that this is fairly in alignment with the dorsal hoof wall. If we were to follow it down, it's fairly in alignment. But once we reach this area here, our separation starts to occur. So it begins to separate and shift outwards. So that's our wall separation. So main things what we're looking for is rotation. A lot of veterinarians will say it's rotation of the coffin bone, and to a certain degree that it is, but most of that rotation is actually laminar separation. It's the wall pulling away, which then creates the illusion, if you will, that there is actually true coffin bone rotation. One thing to note here in this x-ray is this little area right here at the tip of the coffin bone. There's a little wing, and that indicates that we've got not only chronic laminitis going on, but we've got pedal osteitis, or some bone changes going on there as well. So normal and abnormal. I will say right off the top, laminitis in the horse is a condition created by man. It's created by us. It is not a condition which is contracted or caught from another horse. It is not something that just happens in the horse. It is not even a condition that we can vaccinate against. It is a condition created by the lifestyle which we, as the owners and veterinarians, have provided for our horses. All conditions which are created by us, which includes the vast majority of conditions in the horse, can therefore be uncreated and improved through reversal of what we have done to create it. The question regarding reversal of the condition and success rate is dependent upon how far the internal problem has developed. The more damage done to the body, the more difficult it is going to be to remedy completely. Keep in mind that all disease is a result of imbalances within the body. Why do horses develop laminitis? Laminitis is a multifactorial medical condition in the horse. There is no one reason as to why they develop laminitis. There's always a metabolic component, especially in the chronic metabolic horses. I would wager to guess that there's a metabolic component in the acute ones as well. But there's always a metabolic component, and this is not always indicated or evident or noted on the blood work, but a lot of these horses are in pre-stages, as I like to say. So a lot of these horses start off with an overweight body condition, not necessarily obese, but they start off in an overweight body condition. If you were to check their metabolic levels, meaning an insulin panel, things along those lines, most of the time they're normal at that stage. But that is the stage that you are starting to develop cellular dysfunction. We don't see it, we don't recognize it until we have been pushed over the edge and we develop the metabolic component, and then next thing we know, we have sore feet. So in addition to overweight body condition, there's almost always a digestive imbalance. There's usually an improper diet, there's inadequate exercise, and there's improper trimming and balancing of the hoof, almost always. All factors contribute to a systemic inflammatory response in the horse. This then impacts cellular function and glucose insulin function and impairs tissue integrity and hoof health and impairs circulation. All of those then lead to a breakdown of the hoof tissue, laminar tissue, and everything that we see clinically in the foot. But you got to keep in mind that what we're seeing in the foot is a reflection of what's going on inside of the body. So we don't just address the foot here, we address the entire body. Your goals for laminitis management. First and foremost, get the hooves trimmed and balanced and maintain this on a routine basis, which can be as often as every 2 weeks. Keep in mind that hoof growth is impaired in the laminitic horse, and thus, if you desire optimal balance, more frequent trims may be necessary and often are. Evaluate the diet. Remove all grains and all processed foods, which includes most vitamin mineral supplements, because they are processed. They are actually very heating to the body, which can actually contribute to more inflammation. Manage the systemic inflammatory response, which will assist with their comfort and circulation and overall tissue health. Manage their insulin function, manage digestive health, increase exercise, and reduce body weight. I do not generally encourage dry lotting and feeding of lower quality forage as has been traditionally recommended, nor do I encourage stall confinement. I want these horses to resume back to a normal lifestyle. I want them fed very high quality forage, and I want them managed properly. The more we dry lot, the more we create stress. The lower quality forage we feed, the more we deprive the body of nutrients that it needs to try to heal. So keep that in mind. Conclusions. There is no one thing that you're going to do to resolve or improve laminitis in the horse. It is a result of multiple factors from diet to lifestyle to digestive health and improper trimming. One has to address all factors for optimal outcomes. Pharmaceutical medications only address inflammation from a limited standpoint. Best results are obtained through proper herbal use and dietary modifications along with lifestyle factors. Metabolic influences must be addressed, even if your horse's blood work does not indicate there is a problem. Digestive health is paramount and is not managed with probiotics. Herbal therapies allow us to rebalance the microbiome, impact the inflammatory response, and improve overall transformation of foodstuff, which then fuels cells for recovery and function. Laminitis is managed 24/7, 365 days per year. It is not resolved and then forgotten. There is a pattern present in your horse creating the imbalance and lack of health. This can be rebalanced, but if certain regimens are not kept in motion, your horse will quickly become unbalanced once again, and the laminitis will return. This is why we have chronic laminitis. It continues to come and go, come and go, and come and go. Recommended herbal therapies for consideration in these laminitic cases. The Cur-OST EQ Pure or the Cur-OST EQ Inflamed is generally the main anti-inflammatory blend that we will use. It has broad spectrum types of capabilities and potential in these horses. The Cur-OST EQ IS blend is what we will use to help encourage a proper and healthy insulin and glucose response. And then the Cur-OST EQ Tri-Gut is what we will add in to help with digestive health. Questions. If you have questions, contact us, www.curost.com with general inquiries. Personalized contacts, if you want to dig into your horse a little bit deeper, I'm more than happy to do that with a consultation. That can be done at www.secondvet.com. I want to make a note that we do have some really nice books that are available at curost.com, some of them regarding metabolic tendencies in the horse and how to manage them. Great stuff. And we also have online courses which are available. So you can visit www.nouvelleresearch.teachable.com for online courses and further learning. If you have other questions, feel free to contact us. Hopefully this has helped. And if you have further questions, we can maybe address those in a future video. Thank you.